what is vestibular rehab? When we talk about what the vestibular system does and how it works with the rest of our systems, anything you do that uses those systems is going to be rehabilitation. It's going to be something that's going to stress and strain and utilize it. So there's a couple of different terminologies that you'll see. One is vestibular recovery or adaptation. Basically, you haven't been using it, so it's subpar. It's not as good as it could be. So you use it. You challenge the vestibular system. Well, how do you do that? You move your eyes. You can literally do it from your seat. You can literally look right, left, right, left, up, down. That's a vestibular exercise, believe it or not. You also can do the opposite. Look at something, engage it, move your head back and forth. This is a vestibular exercise. So basically you have levels of exercise. You can stick your finger out, look at your finger, move your head. You can move your finger, not your head. You can move your finger and your head. Those are advancing the challenge level of it. So all of those, you just establish a baseline where it could be that you do a dynamic visual acuity test. That's going to establish what their gaze stabilization is. And then you start doing these types of exercises. You want to look for, when you think about the 1 repetition maximum, you think about something that pushes the limits. Think about something that they can do for a range of maybe 30 seconds to a minute, and that before they start to feel a little yucky. And I use the term a little yucky, a little bit, that feeling of motion sickness that you just, that very first sign. So that's usually what I tell my patients is just right when you start to feel that initial feeling of, that sort of foggy in your head, little bit of kind of slight queasiness, stop. Don't do any more. Recover. That's your rest. It may be that they recover like that. They recover within a minute, and they do another set. Or it may be that they don't recover very quickly. That's the exact same method as you use with a patient who does some rest, so maybe some weightlifting, and then they don't recover very well, versus the one that does. We all have that, right? We have a patient who, endurance-wise, they run out of energy, and they don't bounce back quickly, and they can't do as many reps the next time, versus the one who rests a little bit, and they can do another set, rest a little bit, and they can do another set. That's how you do the test. If they start to have symptoms, and they stop, and the symptoms subside within a short period of time, a minute to 5 minutes, and then they can do another repetition without it being any worse. They can do the next repetition with the same amount of onset, and then they recover the same amount. That's a good set for them to do. That's going to be your predicted one. If it doesn't recover quickly, you overdid it. Back it off a little bit. So from a level of intensity, it's eye movements in increasingly challenging situations. Also doing eyes open, eyes closed. So another thing I very commonly will do is whatever exercise they can do, let's say we're working on sit to stand. So we do a sit to stand, maybe set 2 of them. Do 2 sit to stands, really pay attention to what you're doing, and now close your eyes and do 2 more sit to stands. Now open your eyes and do 2 more sit to stands. Now close them. Or it could be you do 10 sit to stands, now do 10 more with your eyes closed. I also have people, I know New Step is a pretty common piece of equipment. I don't know if you all have access to like a New Step or an elliptical or something that you use where they could safely do a minute with their eyes open and then have them close their eyes and do a minute. And then they can open their eyes, or they close their eyes and do as much as they can comfortably at a speed. And you may note your speed went down. You were at 50 RPMs and now you're at 20. I want you this time to try to keep your speed up. And that's going to help try to improve their ability to coordinate their body while their eyes are closed. And that's going to help improve their vestibular function and coordination. Okay, so then moving along, you can put them on different, more challenging surfaces. You may have someone who can only exercise in a more private room. If there's a lot going on around them, they don't do well. So that kind of person, you want to start increasing the level of challenge to them, like have them start coming at more busy times of the day, or at that point, then you can have them work while you can get these programs where it's got like activity going on an iPad, where it's got lines going across and things like that. That's going to cause more challenge, where you have them exercise while this is going on. A lot of times I'll have somebody say on a New Step, and I'll have them doing head and eye movements. Okay, so basically that's a recovery or adaptation, and we'll talk a little bit more about different exercises to do. Substitution is where you can't fix it. They have a deficit, and you need to make them safe, but they can't do it, so you use substitution, making sure they use their visual system, make sure their eyes are as good as they can be, and that they use their corrective eyewear, make sure they understand the importance of a high-lit environment, that they understand if you were to go into a dark room, you will likely fall. You need assistance. And so they understand if I'm gonna be out at night, I'm gonna have somebody go with me so that I can touch their elbow and follow them. And they just know not to put themselves at risk. Or if they're gonna go to the movies, that they have assistance, or they get there early before the lights go down, and they stay till the lights come back up and don't leave until then, or they have somebody help them. It might be that they use a cane. Habituation sounds horrible. It's repeatedly doing the bad thing that bothers them over and over and over again. To me, you can't tell the difference. I could be doing, it's what my intention is. Regardless, is how, to me they both look the same as recovery and adaptation. Looks very similar to habituation. It's basically just this movement bothers them. I can't necessarily, there's not a problem I can fix like a BPPV, so we're just gonna keep doing it until, we push the symptoms back. It really looks very similar and almost synonymous with doing the exercise till it makes you just feel slightly yucky, and then rest, and then do it again. They kind of look the same, would you agree? On the outside looking in, it's what your intention is different.